I want to talk to you today about something that seems so ordinary, so easy to dismiss, that almost everyone overlooks it. And yet, that can sometimes be an important early clue your body is giving you about a serious but very manageable condition. I'm talking about being thirsty all the time, or having a persistently dry mouth, drinking and drinking but never quite feeling satisfied, your mouth always parched. Now, let me be honest and reassuring right from the start. Because thirst and dry mouth have many causes, most of them ordinary and harmless. And I don't want to alarm anyone who's simply a bit dehydrated or whose mouth is dry from a medication. But there's a genuinely valuable point here worth understanding. Persistent, excessive thirst, especially when it comes together with needing to urinate frequently, can sometimes be an early sign of diabetes, or of diabetes that isn't well controlled. And catching that early matters enormously because diabetes is very manageable, but left undetected, it quietly causes serious harm. So today I want to explain the common harmless causes of thirst and dry mouth, and then, importantly, explain the particular pattern that points to blood sugar as the clue, why it happens, why catching it matters so much, and what to do. And I'll keep this calm and balanced throughout, because most thirst is nothing serious, but knowing when it's a clue worth checking is genuinely valuable. Let me start with the common, harmless causes of thirst and dry mouth, because they cover most cases and I want to reassure you before we get to the important pattern. The most obvious cause of thirst is simple dehydration, not drinking enough fluid, which is genuinely common in older adults because, as I've discussed elsewhere, the sense of thirst fades with age, so older adults are often somewhat underhydrated. Hot weather, exercise, sweating, and eating salty foods all increase thirst normally. Dry mouth specifically, as I've discussed in detail elsewhere, is most often caused in older adults by medications. Hundreds of common drugs cause it as a side effect, and their effects add up in people taking several, as well as by breathing through the mouth, by dehydration, and by other factors. So a great deal of thirst and dry mouth is simply ordinary, not drinking enough, hot weather, salty food, or the very common medication-related dry mouth. None of that is cause for alarm, and the response to ordinary thirst and dry mouth is the sensible hydration and dry mouth measures I've discussed. So please don't assume that being thirsty or having a dry mouth means something is wrong. Far more often, it's one of these ordinary, manageable things. But now let me get to the important point. The pattern that makes thirst a potential clue to blood sugar. Because this is what I most want you to understand. There's a particular kind of thirst that's worth paying attention to. Persistent, excessive thirst that doesn't quite go away no matter how much you drink, especially when it comes together with needing to urinate more frequently, including getting up at night to urinate. That combination, excessive thirst plus frequent urination, is one of the classic early signs of diabetes, of high blood sugar. Let me explain why these two go together, because the mechanism is genuinely illuminating and makes the connection clear. When blood sugar is high, as in diabetes, the body tries to get rid of the excess sugar by passing it out in the urine. But to flush out all that sugar, the kidneys have to produce a lot more urine, pulling extra water from the body to do it. So high blood sugar causes increased urination, your body literally trying to wash out the excess sugar. And because all that urination is drawing water out of your body, you become dehydrated, which makes you thirsty, so you drink more, and then urinate more, in a cycle. So the excessive thirst and the frequent urination of high blood sugar are two sides of the same process. The body flushing out excess sugar through copious urine, which drains your water and drives the thirst. That's why these two symptoms classically appear together and why their combination is such a recognized clue to diabetes. So, while thirst alone is usually ordinary, persistent excessive thirst together with frequent urination is exactly the pattern that should make you think of blood sugar and get it checked. Let me tell you the other signs that can accompany high blood sugar, because they round out the picture and help you recognize when blood sugar might be the issue. Along with the excessive thirst and frequent urination, high blood sugar or developing diabetes can cause increased hunger, sometimes despite eating. Unexplained weight loss, as the body, unable to use sugar properly for fuel, breaks down its own fat and muscle. Fatigue and low energy because the cells aren't getting the fuel they need. Blurred vision as high sugar affects the eyes. Slow healing wounds and frequent infections, as I've discussed elsewhere. Tingling or numbness in the hands or feet from nerve effects. And a generally unwell, run-down feeling. Now, here's something genuinely important about diabetes in older adults. It often develops gradually and quietly, and its symptoms, the increased thirst and urination, the fatigue, the blurred vision, can be subtle or easily attributed to other things, or just to aging. So type 2 diabetes very commonly goes undiagnosed for a long time, sometimes years, quietly causing damage before it's caught. That's exactly why recognizing the clue of persistent excessive thirst with frequent urination and getting checked is so valuable. It can catch diabetes that would otherwise go undetected. So the pattern to recognize is excessive thirst and frequent urination, possibly with increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing or tingling. And the right response to that pattern is to get your blood sugar checked. Let me explain why catching this early matters so much, because this is the crux of why I wanted to talk about it. Diabetes, when undetected or poorly controlled, quietly causes serious harm over time because persistently high blood sugar damages blood vessels and nerves throughout the body. Over years, this can lead to heart disease and stroke, kidney disease, vision loss and blindness, nerve damage, and the poor circulation and slow healing that can lead to serious foot problems, as I've discussed. These are serious, life-altering complications. But, and this is the genuinely hopeful and important part, diabetes is very manageable, especially when caught early, through lifestyle measures like diet and activity, weight management, monitoring, and medications when needed, and good blood sugar control dramatically reduces the risk of all those complications. So the whole point of recognizing the early clue is this: catching diabetes early, prompted by something as simple as noticing persistent thirst and frequent urination, allows you to manage it well and prevent the serious harm that undetected, poorly controlled diabetes causes. Early detection genuinely changes the outcome. That's why I don't want you to dismiss persistent excessive thirst with frequent urination as nothing. It could be the clue that lets you catch and manage a condition that, left hidden, does real damage. The awareness is about timely action and protection, not fear. So let me be clear about what to do, because the path is simple and worthwhile. If you have persistent excessive thirst that doesn't go away with normal drinking, especially together with frequent urination, including at night, and especially if you also have any of the other signs, increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing wounds, or tingling in the hands or feet, see your doctor and ask to have your blood sugar checked. This is a simple, quick, inexpensive blood test that can detect diabetes or prediabetes. It's such an easy thing to check, and it can reveal something so important to catch. And it's worth knowing that doctors recommend regular screening for diabetes in older adults anyway, even without symptoms, precisely because it can be silent. So if you haven't had your blood sugar checked recently, it's worth doing as part of your regular care regardless. But the particular pattern of excessive thirst and frequent urination is a specific prompt to get it checked promptly rather than waiting. So the action is simple. Notice the pattern and get your blood sugar checked, because catching diabetes early allows you to manage it and prevent serious harm. Let me also be clear and balanced about the other side, because I don't want to send everyone with a dry mouth into worry. Most thirst and dry mouth, as I said, is ordinary dehydration, hot weather, salty food, or medication-related dry mouth, and is not diabetes. The combination that specifically suggests blood sugar is persistent excessive thirst together with frequent urination, ideally with some of the other signs, rather than ordinary thirst or an isolated dry mouth from medication. So if your dry mouth is the medication-related kind I've discussed, with no excessive thirst and urination pattern, that's a dry mouth issue to manage as I've described, not necessarily a blood sugar concern, though if in doubt, a blood sugar check is easy and worthwhile. The point is to recognize the specific diabetes pattern, excessive thirst plus frequent urination, while not panicking over ordinary thirst or dry mouth. And of course, regardless of the cause, staying adequately hydrated matters. Just be aware that if the thirst is persistent and excessive and paired with frequent urination, drinking more is treating the symptom while the underlying high blood sugar needs checking. So drink enough, manage ordinary dry mouth sensibly, but recognize the specific pattern that warrants a blood sugar test. Let me also briefly distinguish a couple of things because clarity helps. Persistent excessive thirst and urination is the diabetes pattern. By contrast, getting up at night to urinate without the excessive daytime thirst can have the various other causes I've discussed elsewhere, like prostate issues or fluid timing. So it's the combination with excessive thirst, and ideally the other signs, that specifically points to blood sugar. And a very dry mouth combined with very dry eyes, as I've mentioned elsewhere, can point to a different autoimmune cause worth a doctor's attention. Your doctor can sort out which is which. The reason I mention these is to help you recognize that it's the specific cluster: excessive persistent thirst plus frequent urination, possibly with hunger, weight loss, fatigue, or blurred vision. That's the blood sugar clue, while isolated symptoms have other explanations. But when in doubt, a blood sugar check is simple and worthwhile, so there's no harm in getting checked. Let me paint you a picture of how this commonly plays out, because it shows the value of recognizing the clue. Picture a man in his 60s who, over some months, finds himself constantly thirsty, drinking far more than usual but never quite satisfied, and getting up several times a night to urinate. He's also been more tired than usual, his vision has been a bit blurry at times, and he's lost some weight without trying, all of which he's been attributing separately to aging, to drinking more, to needing new glasses. He doesn't connect the dots, but the dots connect. This is the classic pattern of high blood sugar. Eventually, perhaps prompted by the persistent thirst and nighttime urination, he mentions it to his doctor, who recognizes the pattern and checks his blood sugar, finding type 2 diabetes that had been developing quietly. Because it's caught, he can manage it through diet, activity, weight loss, and treatment as needed, bringing his blood sugar under control and protecting himself from the serious complications that undetected diabetes would have caused over the coming years. The simple, easily dismissed symptom of being thirsty all the time was the clue that led to catching and managing a serious but manageable condition in time. Now, in another version, his persistent thirst might turn out to be simple dehydration or a medication effect, and the blood sugar check reassures him, which is also a good outcome. Either way, recognizing the pattern and getting checked was exactly right. That's the value of understanding this clue. And let me speak directly to those of you caring for or close to an older person, because this clue is easy to miss and the stakes are real. You might notice a loved one drinking unusually much, always thirsty, getting up frequently at night to urinate, more tired than usual, losing weight without trying, or with blurred vision. And because these can be attributed separately to aging or other things, the underlying pattern can go unrecognized. You can help by recognizing the cluster: persistent excessive thirst with frequent urination, possibly with increased hunger, weight loss, fatigue, or blurred vision, and gently encouraging them to see their doctor and have their blood sugar checked, since it's a simple test that can catch a serious but very manageable condition early. You can reassure them that most thirst is ordinary, but that this particular pattern is worth checking, and that catching diabetes early allows it to be managed and serious harm prevented. You can also encourage regular diabetes screening as part of their routine care, since diabetes can be silent. Helping a loved one recognize the early clue of persistent thirst and frequent urination and get their blood sugar checked can lead to catching and managing diabetes in time to prevent the serious complications it otherwise quietly causes. Let me draw this all together. Being thirsty all the time or having a dry mouth is usually ordinary, caused by dehydration, common in older adults with their fading thirst, by hot weather or salty food, or by the very common medication-related dry mouth, none of which is cause for alarm. But there's a particular pattern that makes thirst a valuable clue to blood sugar: persistent, excessive thirst that doesn't go away with drinking, especially together with frequent urination, including at night, is one of the classic early signs of diabetes, because high blood sugar makes the body flush out excess sugar in copious urine, which drains the body's water and drives the thirst in a cycle. This pattern may come with increased hunger, unexplained weight loss, fatigue, blurred vision, slow-healing wounds, or tingling in the hands and feet. And because diabetes often develops quietly in older adults, it commonly goes undetected, quietly causing serious harm to blood vessels and nerves over time. But diabetes is very manageable, especially when caught early. So recognizing this clue and getting your blood sugar checked, a simple test, allows you to catch and manage diabetes and prevent serious complications. Most thirst is ordinary, but the specific pattern of persistent excessive thirst with frequent urination is worth checking. So here's what I'll leave you with. First, understand that most thirst and dry mouth is ordinary, from dehydration, hot weather, salty food, or medications, and not a cause for alarm, so don't panic over being a bit thirsty or having a dry mouth. Second, recognize the particular pattern that's a valuable clue to blood sugar: persistent, excessive thirst that doesn't go away with drinking, especially together with frequent urination, including at night, which is a classic early sign of diabetes. Third, watch for the other accompanying signs: increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing wounds, and tingling in the hands or feet, which strengthen the case for getting checked. Fourth, if you have that pattern, see your doctor and ask for a simple blood sugar test, because catching diabetes early lets you manage it well and prevent the serious harm to your heart, kidneys, eyes, nerves, and circulation that undetected diabetes quietly causes. And consider regular diabetes screening as part of your routine care anyway, since diabetes can be silent. And fifth, hold the balance. Most thirst is nothing serious, but the specific cluster of persistent excessive thirst with frequent urination is exactly the clue worth heeding. That ordinary seeming symptom of being thirsty all the time could, in the right pattern, be your body's early warning about your blood sugar, and heeding it could let you catch and manage something important in time. So take care of yourself, stay sensibly hydrated, recognize the pattern that points to blood sugar, and get checked if you have it. And because diagnosing diabetes and managing it require a doctor, please treat persistent excessive thirst with frequent urination as your reason to get your blood sugar checked by your own physician, who can diagnose and help, rather than as a substitute for that visit.